Avoid these activities after your COVID vaccine. Physical activities are essential to maintain an active lifestyle and a healthy body. However, there are certain limitations on when and how long you should exercise. This is because no matter how good exercising is, too much can hurt the body. Moderation is key to any kind of activity, mental, physical, or even social. According to Yahoo, the Ministry of Health or MOH of Singapore released a new advisory concerning individuals vaccinated against COVID-19. This advisory supersedes an early advisory dated June 11. On July 5, MOH advised newly vaccinated people to avoid strenuous physical activities, including swimming, cycling, jogging, and ball and racket games. Yet activities such as casual walking, stretching, and housework are considered safe. The recommendations are now being updated based on the additional data that has since accrued both locally and internationally, MOH advised. The reason is the small risk of myocarditis and pericarditis observed after getting mRNA COVID-19 vaccines. Although this risk remains low compared to the benefits, the public should be aware and refrain from strenuous activity a week after vaccination. If they experience chest pain, abnormal heartbeat, or shortness of breath, they must seek medical attention right away. At the same time, doctors should be vigilant in clinical presentations among those who received the vaccines. Since teens and young adults are physically active, they must take a break from their usual exercise routine, including physical education activities, competitive sports, and heavy lifting. The advisory was also based on 12 reports of myocarditis and pericarditis as of June 30 following mRNA vaccines. Of that, 5 were adults aged 30 years and older, and 7 were males younger than 30. MOH Singapore added that if anyone vaccinated with an mRNA COVID-19 vaccine is diagnosed with myocarditis, they should no longer receive additional doses. The ministry continues to recommend these vaccines for all eligible individuals, adolescent and young adult men included. But vaccination should always be voluntary. According to the US CDC, the cases of heart inflammation or myocarditis and pericarditis following mRNA vaccines are rare, given the millions who have been vaccinated. Symptoms are usually mild and definitely treatable. So what does the advisory imply? Because the two conditions affect the heart, excessive physical activity may add more stress to the organ. Until the symptoms are resolved, the person should not exert too much effort. Perhaps it is high time for them to get some R&R for 7 days.